Welcome back to the channel. Today, we're looking into one of the most frequently ordered and foundational tests in all of medicine, the complete blood count with differential, or CBC with diff. Whether you're a med student, a clinician, or just someone trying to understand your lab results, this video will give you a full breakdown of what each value means, how to interpret abnormalities, and why it matters in real clinical decision-making. The CBC gives us a snapshot of three main components in the blood: red blood cells, white blood cells, and platelets. When we add a differential, we're breaking down those white cells into their specific types, each with unique roles in health and disease. Let's break it down. White blood cell count, BC. Normal range, roughly 4 to 10.5 thousand per microliter. It's our general indicator of immune system activity. Elevated, think infection, inflammation, or leukemia. Low, maybe a virus, medication, or bone marrow issue. Red blood cell count, RBC, hemoglobin, hematocrit. These three are your oxygen-carrying players. Low values point to anemia, and you need to dig deeper. Look at MCV next. MCV, mean corpuscular volume. This tells you the size of red blood cells. Small, think iron deficiency or thalassemia. Large, B12, folate deficiency, alcohol, liver disease. Normal size but still anemic. Could be chronic disease or acute blood loss. RDW, red cell distribution width. High RDW means mixed cell sizes. It's useful when you're seeing more than one type of anemia at once, say iron deficiency overlapping with B12 deficiency. Platelet count and MPV. Platelets are essential for clotting. High levels may be reactive or a sign of myeloproliferative disease. Low levels, think destruction, underproduction, or sequestration in the spleen. Now, for the differential, the breakdown of white blood cells. Neutrophils 40-70%, rise with bacterial infections or stress. Lymphocytes 20-40%, think viral infections or CLL if elevated persistently. Monocytes 2-8%, chronic inflammation, TB, autoimmune conditions. Eosinophils 1-4%, parasites, allergies, EGPA. Basophils 1%, rare but can signal myeloproliferative disorders like CML. Each cell line tells a different story. Trends are just as important as absolute numbers. So what are some common abnormal patterns we see? Anemia, look at MCV on reticulocyte count. Leukocytosis, neutrophils suggest bacteria or steroids. Lymphocytes, viral illness. Eosinophils, allergies or parasites. Thrombocytopenia, could be marrow suppression, immune destruction, or a splenic issue. Always correlate with the clinical picture. A high white count in a patient with fever and cough, probably pneumonia. A low platelet count in a lupus patient, maybe ITP. In rheumatology, the CBC helps us track disease activity and complications. Anemia of chronic disease, usually normocytic. Leukopenia or thrombocytopenia could be autoimmune, especially in lupus. Eosinophilia, think eosinophilic granulomatosis with polyangiitis, EGPA. If something looks off, you might need to go further. Peripheral smear, iron studies, B12 folate levels. Bone marrow biopsy, flow cytometry for leukemias. Repeat CBCs over time to assess trends. The CBC with differential is more than just a list of numbers. It's a story of what's happening inside the body, and when interpreted correctly, it can guide powerful clinical decisions. If you found this helpful, give it a thumbs up, subscribe for more deep dives, and drop a comment below with any questions or topics you'd like covered next. Thanks for watching.